Okay, moving on from the TMJ, the jaw, we're going to go into the tongue and the back into the pharynx. The root of the tongue goes almost to the epiglottis, you could say. So that's the working the superior part of the throat. So we're going to load the tongue. And as I said, the tongue is sensory to 3 or 4 nerves. CN12 is a motor to the tongue as the somites come around. That 12th cranial came as well for the hypoglossal nerve. But the chorda tympani and the facial nerve, trigeminal nerve, glossopharyngeal nerve. And then some of the hookups with the, of course, the sympathetic nervous system, superior cervical ganglia, sympathetic connections with the cervical plexus and with the cranial nerves as well. So we'll load the tongue. I start gently, but as I get used to it and relax it, we can go further. Strange sensation, huh? Mm-hmm. If we lift the tongue up too high, there's a frenulum that's tightened, so if we stay down this way. Buccinator muscle. Lots of muscles in the face that we can load intraorally. Always looking for the patient's response. Head and neck's very complicated. A lot of structures. The arterial supply, the internal, external carotids, collateral circulation. Each one of these branchial arches had a blood vessel. There used to be the aortic arches. There used to be 6 aortic arches with the gill arch, and then there's only 1 aortic arch, of course. But each one of these arches, except the 5th, does have a blood vessel remaining, and they're blood vessels in the neck. Of course, the artery has an associated vein, and it has associated nerve, and it has an associated autonomic nervous system supply as well. Autonomic nervous system, where does the sympathetic nerve supply come to feed the brain? We know there's sympathetic nerves, there's blood vessels in the brain. Where do the sympathetic nerves come from the brain? We know the sympathetic outflow is from the spine, and we know that the ganglia, the superior, middle, and inferior cervical ganglia come from the thoracic spine. So where do the sympathetic nerves come in the brain? Well, they come up from the thoracic spine, up through the cervical ganglia, and actually they go into the brain through the foramen magnum and through foramen lacerum. Can you affect the sympathetic nerve supply? Can you affect the sympathetic supply to the brain by loading the sympathetic nerves before they go into the brain on the way back, on the way up the neck, the recurrent autonomic nervous system? I think so. These traction moves I just showed, there's no reason why that might not load these recurrent autonomic nervous systems into the brain. I hope you appreciate that I'm just touching on the surface with some of these procedures. Once you understand the relationship between the tendons, the nerves, the blood to these nerves, and the ramifications, then you should be able to adopt some of your own procedures and practice them in a safe and effective manner.